Hello, welcome friends to CNS Viewpoint. Today we are going to talk about an important presentation made by Dr. Tara Singh Bam, who was a faculty at Johns Hopkins University, Bloomberg School of Public Health, Institute for Global Tobacco Control's 2022 South Asia Leadership Course on Tobacco Control. So Dr. Tara Singh Bam presented data which was recently published. And other researchers were Ananda Chand of Nepal and one more, if I remember the name correctly, Dr. Shah. So basically that research says that pictorial warnings are very effective in doing two things. Number one, they encourage existing smokers or tobacco users to quit. Number two, they prevent any new child or young people to begin tobacco use. So Dr. Tara Singh Bam had rightly said that these are the only two ways you can actually reduce tobacco use. You can prevent people from beginning tobacco use so that there is no new customer, and those who are using tobacco right now, if they quit tobacco, then it will be end of tobacco. So pictorial health warnings, graphic pictorial health warnings, 90% is the size as of now in Nepal. They were very effective in doing both. So they were hitting the beast in the belly where it hurts most. So no wonder tobacco industry has been up in arms against pictorial health warnings, not only in Nepal but several other countries, because it encourages its existing users to stop using the deadly tobacco and choose health. So basically it harms tobacco industry is not able to protect its markets. And second is the graphic pictorial health warnings prevent new users, new potential customers to begin tobacco use, new children and young people to be deceived into the land of lies, the addiction of tobacco. So tobacco industry is definitely up in arms, and more interestingly, it is very high time that government should be holding the industry to account for more than 8 million deaths every single year after year. Each one of those deaths could have been averted. Imagine the COVID-19 has caused about 6 million deaths, which is so sad indeed, because even one untimely death is a death too many. But if you look at tobacco, it has been killing 8 million people every single year. Each of those deaths was also untimely and could have been avoided if an industry whose product kills 1 out of every 2 users, as per the World Health Organization, so is allowed to function. We need to hold them to account and hold them legally and financially liable for the damage they have caused to human health and also our planet. So I hope more sense will prevail. I hope not just graphic pictorial health warnings, large but also plain packaging becomes a norm as soon as possible, because time is really ticking. Clock is ticking. We are losing time. It's a race again to save lives, and we are not doing work which is fast enough. This is what I feel. If you compare tobacco control with other promises made by our governments, for example, to end tuberculosis, all these are interdependent, because tobacco puts people at risk of tuberculosis, puts people at risk of bad treatment outcomes of tuberculosis, puts people at risk of dying of tuberculosis, puts people at risk of converting latent tuberculosis into active TB disease. And same way you will find deadly relationship between tobacco and diabetes, or tobacco and cardiovascular diseases, or cancers, or others. So it is, if we are to deliver on the promises of sustainable development, where no one is left behind, probably the lowest hanging not fruit But action through is to end tobacco. That is, and hold the industry to account legally and financially, so that governments can have some resources to rather invest in sustainable development, and also have double benefit of so many more benefits of bringing an industry to account and make it pay for the damages it has caused to human life and health. With these words, I will end today's CNS Viewpoint, and I will be back again tomorrow, like every day at 5 p.m. India time, with the thoughts and views and perspectives on something that made us think. Bye till then. Stay safe. Stay away from tobacco always. In case if you're using it, quit. There's no better time to quit than right now. Take the best decision which is in your own interest and in the interest of your family members and loved ones, and of course of our planet. Kick the industry out. Stay safe. Bye bye.